welcome to everyone, and thank you for joining us today for a webinar on the future of dental education. Apologies for the issues we had this morning just with technology, setting up the stream. But again, a huge thank you for joining us today. And we've got a fantastic lineup as well of people joining us. But just to give you an idea of what we're doing today, so let's go over how universities train at the moment and see how we're looking to improve that. So universities, you probably know better than I do, we use a lot of patients to practice on to get real training, and we use extracted teeth alongside inside the phantom heads. Now, normally we have a few challenges with that anyway. The patients are put at risk, use them too early during the student training. The consumables are expensive. We have to keep buying the plastic teeth as soon as we work on them. And students are expecting technology, they're expecting quality curriculums when they come to universities. So we need that to be able to in these modern times. Now, obviously, we have a few added complications as well with everything that's going on in the world at the moment. So the spread of diseases is key. Using aerosols in conventional simulations is spreading diseases if they're not controlled. The social distancing, keeping people far away from each other so they don't spread the disease. And what do we do for people at risk who have respiratory problems? So that's what we're looking at today, and what can we do to help limit some of those as well. So some introductions from everyone we've got here. I know a lot of you that have joined us today already. My name's James Markey. I've been with HRV Simulation for the last few years, the Virteasy business internationally, and I'm now the CEO of our new business, Universal Simulation, which looks at desktop simulation for universities who can't quite afford high fidelity simulation. So thank you, just had a few issues with the sound there, but an introduction from Arno to HRV, looking at Virteasy Dental and Now Solution. And we're fortunately joined by one of the team members as well, who I've known for a few years now. Pierre-Jean, are you with us? Can you hear me? Arno to HRV, looking at Virteasy Dental and Now Solution. Would you like to give a little introduction of yourself to everyone that's there, Pierre-Jean?
The team members as well, who I've known for a few years now. So my name is Pierre-Jean, I'm the project lead designer. I've worked on this project for 4 years now, and I look forward to participating with you all in today's webinar and maybe giving you a little introduction. So please don't hesitate to ask any technical questions. I'll try my best to answer them at the end of the webinar.
Fab, thank you very much for the introduction, Pierre-Jean, and we'll come back to you a little bit later as well for the technical questions on the Mentimeter. Now, we're super fortunate as well today to get one of our clients, Diego and Pedro from ADEMA, who myself and Pierre-Jean have had the benefit of going there. So let's see if we guys up on the screen. There we go. Can you hear me okay? Can you hear me, Diego? Can you hear me there? I think you're on mute on Skype for the moment.
Okay, now you listen to me?
We can hear you nice and clear. So,
okay.
So first of all, just a big thank you for your warm welcome to myself and Pierre-Jean when we came to Palma. It was really nice for us.
Yeah, here we are, Dr. Alomar and me, to explain experience with the Virteasy simulator in our dental school. For us, it's very fortunately to stay here and try to explain our experience
with our students, teachers, and the people to visit.
Good afternoon from Palma de Mallorca and welcome from our university, and we are very happy to see you. We hope you enjoy this webinar.
Fab. Well, thank you very much, and it's nice to have you here as well, so thanks for joining. Okay, fab. So it seems like we've got a little bit of a mix, people, and we'll leave the Mentimeter open for you as we go along as well. So you'll be able to use Mentimeter to ask questions to any of the speakers as we're going along. And you'll be able to do that both during and after the webinar, during the record. So if you're watching the recording, you can still ask questions and we'll pick them up on the newsletter as we go along. So the whole point today is looking at how simulation can help some of these obstacles in teaching. So for those of you who responded saying you've not got any haptic devices, this just gives you a little bit of an idea. So haptics is the feeling of touch you get. So we use the haptics to do things like drilling, and we get the sensation that's what we're actually doing in real life, even though it's just the motors that are pushing back at us. And then virtual reality, both within the simulators and virtual reality headsets, is what gives us the sight, the immersiveness of it all. So to understand where simulations come from, in dentistry, one of the first projects was 2007 with the Haptel project at King's College, using basic haptics and 3D visuals. The new generation of haptic simulators, so this is Virteasy Dental, have haptics that are capable of implantology and oral surgery, and virtual reality immersive graphics, so that we're able the environment we're in and not just the teeth that we're working on. So this is the Virteasy Dental Simulator that's been around since 2015. We've got a short video just to show you the simulator, and then I'll hand over to Pierre-Jean to give you a good background on it.
Virteasy Dental is a haptic simulator that allows to perform a virtual surgery on a virtual patient.
All subjects from restoration, post-odontics, endodontics, and implantation.
So we saw Pierre-Jean there on some of the videos as well, but I'll hand you over now to Pierre-Jean to give a little introduction to Virteasy and where it's come from and where it's going. So over to you, Pierre-Jean.
Thank you, James. So to that explanation, we've been working on Virteasy since the beginning of the HRV in 2013. We started the first simulators in 2015. Since then, we went on to develop Virteasy, and we launched, for example, the Virteasy Classroom, that is to say, connecting all together along the teacher station in 2018. Thanks to James, who's been helping us a lot. We've been extending internet in more than 15 countries, more than 30 universities, and it looks like it's going to keep getting bigger, which is really exciting for us.
Okay, fab. Thank you for that, Pierre-Jean. And as you can see behind you, there's a few things which are unique to these high fidelity simulators. We've got Virteasy Dental on the left there and Cobra in Sweden that's specifically for surgery. And there's a few things like an integrated design. You have 2 hands for the tracking mirror, height adjustable for the machine, and co-localized with the position of your haptics underneath the... Now, a question for you that's come up, Pierre-Jean, was how powerful are the haptics on the Virteasy Dental simulator?
Well, so the haptic arms is up to 8 Newton, so that means you can feel the bones as well as feeling of the tooth.
Okay, fab. Well, I hope that's answered the question for whoever put that up. And like I say, we'll keep going back to Pierre-Jean whenever there's technical which come up throughout the webinar. So that's our high fidelity simulators. And one of the things to understand is that classroom setup which Pierre-Jean was talking about. So we have classroom simulator connected to a teacher PC. You create new exercises, and you can do that with a 3D library of teeth, intraoral scans using multi-STL, so you get the enamel, the dentine, and you can add in the pulp as well, and DICOM CT integration. Now all that data goes in to create new exercises, and that comes out in the Virteasy Assistant, so you can manage what's happening on the simulators, stream the picture live, etc. And that's what allows us to manually grade the students. And what we're working on today is almost like an exam module, so the simulator can grade the students and test them every year to make sure their core operative skills are up to date. I'm going to ask you guys to share your screen on Skype, and then we'll hand over to you.
Okay, we want to share. Okay, it's okay.
Will you see us?
It's okay now, the screen? Yeah? Okay, try to explain quickly we are where we were. We are from Mallorca Island in Spain, like our friend. It's a beautiful place for live. We are around 1,200,000 citizens. We are in the middle of the Mediterranean Sea, yeah? And we are the Professor Pedro Valdomar, I am Professor Diego González. And this is our school building, yeah? This is our staff of teachers and some students with the president, the lady is the president of the Balearic Island, yeah? And the people from the university, also the university, yeah. Our school is, we have a program with a digital offer, yeah, of dentistry. For us, it's very important, the haptic and the digital system. Our study is in 5 courses. We have 13 in each course, yeah. Also, we have a lot of classroom and laboratories, dental clinics for made all the things that we normally use in a dental clinic. Also, for us, very important the digital flow, yeah. Also, it's important our teacher, like say the UNESCO, yes, the ICT, the competency framework for teachers in digital skills, no? The ICT skills, yeah. Then this is the question, because like say Einstein, learning is experience, everything else is information. The experience, this is the methodological proposal that we are using, yeah? with methodological innovation project. The experimental learning is for us it in a work-based learning, yeah. We have different create environments and provide workspace, yeah. Because we want the autonomous and reflective learning, the acquisition of the skill, also the ability, no? And we need some strategy, applied strategy for solve the problem in different experience, yeah? Then in this work-based learning, we have the oral promotion program with all the new school, also with the student of the primary school in Mallorca, and also the reshare work-based learning. Yeah? We have an observational epidemiological study on oral health, and we go for more of 25 school to make a revision of this student. Also, we need to develop the 3 indicators of the ICT, like say the UNESCO, the technological literacy, the knowledge deepening, and the knowledge creation. Yeah, and we need our teachers this skill for develop their skills. But really, sometimes we need also more disruptive for disruptive education, yeah. Some embodied cognition, haptic technology for us is very important, like the augmented reality, no? Then we need to look for something that helps us to this in our classroom. And then is when we start looking for something to help us, just every once in a while, a revolutionary product comes to along that changes everything. And we find different brands. We need to look for the Haptic system of our lessons, and with different main aspect to value. And then the technology, the technical service, the type of exercise, quality, because this is a quantitative and qualitative decision, yeah? Always we have the great question, what, why, how, when, who, no? It's really haptic, service, it's a multidisciplinary subject, it's economic sustainability, then this decision they have to find that's there. We decide for this brand. The Virteasy is now with us in this classroom in our back. Yes, for us have a lot of very good properties. Yeah, have a versatility of use, technological capacity and design, healthcare equipment. Yeah, and we started in 2018. December to work with this simulator machine. This is our classroom where we are now, Professor Alomar and me. Yeah, we started some time ago our training. Here up to the left we see to James with us in our classroom with some people, some of our teachers and some people of other university to present this simulator. Yeah, also with the regional minister is training with our simulator because we need to develop this in our degree. Now, Professor Alomar going to try to explain like we are integrated in our degree.
Okay, thank you so much. I will start this part of this presentation with the hypothesis. The choice of a good system and its well-programmed use within the curriculum of the degree of dentistry. This is important, that can help improve the preparation of our students. They can offer intentional practice opportunities to the students and projection and transfer of learning to reality. Technical improvement too, acquisition of cognitive and psychomotor skills, And that's one objective and highly accurate note regarding the performance in the competence practice. The last one is corrective feedback. This is very important and one of the most important things we want to our school. Our learning project stems from the need to create a dentist with a profile according to the current and real demands of the society. Digital natives are present in our society, and within the framework of dentistry, it has become the center of our teaching project. The philosophy of the Dentistry University School ADEMA proposes a related training with the use of cutting-edge technology applied to the current needs of patients. Our goal is that the latest generation simulator be implemented in some subjects, both and preclinical, in a progressive way in order to achieve acquisition of skills by students that is effective, efficient, productive, and that give us a touch of distinction with other dental schools. This is our degree in 6 modules. Module 1, Basic Biomedical. Module 2, Introduction to Dentistry. Module 3, Medical, Surgical, Pathology and General Therapeutics. Module 4, Pathology and Dental Therapeutics. Module 5, Final Degree Work and Laboratory Practice. Module 6, Complementary Training in Dentistry. We have in the second year, in the 1, 2, 3, 4 subjects, Year 1, Dental Materials 2, Prosthesis 1, a Dental Pathology, that is include the Virteasy system. In the third year, we have Operative Dentistry, Prosthodontics 2, Pediatric Dentistry 1, and Endodontics 1 that includes the simulator Virteasy. For the year, we have Prosthesis 3, Endodontics 2, Pediatric Dentistry 2, Prosthesis 4, and Oral Surgery 2. And in the last year, the 5th year, is Adult Dental Clinic 1, Child Dental Clinic, Adult Dental Clinic, and Special Patients Clinic.
This is very for us because it's the cloud of the cane, about the decision that we can use in a lot of course and help to us with the typical problem with the patients. Yeah.
This simulator allows the student to perceive all the sensation, both visual and ergonomic, as well as the tactile, helping and then to acquire skills for their future professional development. We want the pupil, the students, make a training before we start with the patients. Of the Virteasy simulator allows the student and the teacher to of a detailed control of the entire progression and progress in the different dental subjects I speak before. Systems allows you to customize tools and add different instruments from different system or commercial houses. All this facilitates the student recognition of the material he will use in his future professional practice. On the other hand, this simulator has training programs prior to the treatment themselves. This allows the student to begin in the perception, contemplation of entering enamel, dentin, or bone too. This is very, very important, in addition to having the possibility of changing of hardness of the same, which generates a high variability of the time of performed treatments, because hundreds of different cases can be created each time and repeat as many times as decide the student or the teacher to. The advantage: Virteasy has an optic arm that acts as a rotating instrument or surgical motor as we want, as well as allow the possibility of indirect vision. It is worth mentioning the incorporation of a pedal for the activation of the instruments in real time and with real sounds as well. An important fact to take into account is the ability of the Virteasy simulator to import data previously registered in a CBCT, allowing the simulator to work both in real patient cases and in cases already installed with the Virteasy program itself. Keep in mind the possibility of seeing on the screen in real time our work progression, our intervention time, our success rate, as well as our intervention in the different planes of space, axial, sagittal, or coronal. All this in turn associated with color coding that helps us identify parts of the tooth treat, not treat, or treat incorrectly. It should be noted that the possibility of performing pre-treatments in a simulator helps us and train us in case of possible eventualities arise during the actual treatment, being able to repeat all the times we want the same exercise. We have the students make the same 1, 2, 3, 4, whatever you want. The Virteasy systems allows to customize tools and add different instruments from different systems or commercial houses. All this facilitates the student recognition of the material he will use in his future professional practice. We can see dental drills in the screen. Our proposal practical class dynamic are based on tutor groups of no more than 10 students, controlled every time and advised at all times by one quality teacher will at all times and provide all their experience and knowledge for the benefit of the student. We can see James, okay, in the center of the screen. With the acquisition of the simulation Virteasy, the school has differentiated from the rest of Spanish schools. This is a very important advantage.
Then we are very interested to know the opinion of our students, of teachers, or stakeholders, and some dentists to visit us some days of the year. The evaluation of the different interest groups related to the teaching of the degree of dentistry. Both the interviews and the surveys carried out can give the opinion and guide us to evaluation the results in the buy of this simulator. One of the quality solution that give to us the student was they enjoy gaming and learning. They feel new sensation, and also I always say that this very reason is they smile when they end the seasons. They are smiling, they are happy. That's very interesting, this question. Also the teacher, they say to us that they find it's a great tool for learning. The student will be able to acquire their skill better. The student can improve their learning outcomes. Also the teacher will have to update. This is the one of the reason that we are working for the learning and the learning of our teacher. Yeah? The teacher needs a learning curve to prepare the class using simulator. The stakeholders think that many of the professionals who have come to visit our faculty enjoy and find that the use of Virteasy is an advance in the methodology of teaching students. They see many pupils. Also, the dentist, the comment of this dentist focus on the benefit they would have had on their beginnings, or they have this technology in their fingertips. But everybody is surprised. Everybody. Nobody say, oh, I know, no. Everybody's with the really of the haptic simulation. Yeah, we made some question in the pool. Then we one question of the level competency of the people. We need to know about the people of the technology. Yes. Also, we have a medium, high level of users in computer. Also, we ask about the digital technology that they use daily. Yeah. Also, we have medium, high. and the level of the about the CAD/CAM design and production process in dentistry. Yeah. Now here we have a the bigger is low, medium, and medium. Yeah. The no so much is working now in CAD/CAM also. Year step to step is bigger. This is the question that they answer. Did you know 3D haptic technology applied to the dentist before meeting? No. Is the more respond they answer no. Also we have here another question. How long do you know the virtual holographic? Only is very 1 year, 6 months. Also the application of haptic technology applied to the teaching of dentistry. You can see red and yellow, 1 year, 2 year is very new. And the level of sensory approximation, and this is a very interesting question. The people say medium high. The purple is the green and purple is the bigger. The people think that there is very approximation to reality. Yeah, like the level of validity for the learning, also high, medium high, no, for the people. What level of utility do you think this technology has to train before approaching a real case? This is also very high, medium high, yeah. The 12th question, do you think well does this technological innovation is used in our university school? 93%, very high, yeah. The comfort, very high comfortable for the people, yeah. And the 14th question, would you have liked to have this of your learning process in not only for dentistry, for other we ask in general, every people say yes. And the last question is, do you think you would have advanced more in learning and better obtain competence able to have this technology during your previous learning process? Every people also say yes. For having this answer of this question for the people, no? Because the advantage in summary with instrumental learning and work tool in the faculty sounds it allows the future dentist to enter the operative field from different perspectives, unlike the times, being able to change internal types of treatments. These results.
Okay, I continue with the webinar results. This implementation has been measured and is the result of the evaluation of different interest groups related to the teaching of the degree of dentistry. Both the interview and the surveys carried out can give off a high degree of user satisfaction and the conviction that it's a tool that can help in the learning of dental professionals. We have the conclusions too. The choice of Virteasy seems to be a good option to solve some lacks that until now had in the teaching within the degree of dentistry, thanks to the great similarity that it has with a real practice and the unlimited possibility of practice that involves the use of these 3D simulators with haptic technology. And for me, thank you so much. Whatever you want.
Fab. Well, thank you for that, guys. And we've got 37 people on the webinar, and I've seen there's a few questions which have come in. So I'm just going to share the Mentimeter because we've got 2 people who have liked the question as well. So I don't know if you can see it on my screen, but I've got, so that's 2 people that have asked, has ADEMA gone back to teaching after COVID, and how? They obviously see your university.
After COVID.
So have you gone back to teaching students already?
Can you see the screen? Ah, okay, thank you so much. We can see now. Has ADEMA gone back to do teaching after COVID?
Yeah,
Yeah,
next Monday.
For sure, for sure. The 1st of June, we start again.
Okay.
How? With the Virteasy simulators.
Yeah. Our opportunity, great opportunity to use the Virteasy, and our student made some groups. Some groups start to make some skills in the simulator.
Okay.
Other go to the dental clinic to start again. Yeah.
And other also with seminary classes too. And we have 4 teachers for all the students.
Also, all under very great condition of security condition. We have check lines in the door to clean shoes, hands, temperature, very high condition of to go inside or school.
We have all the
screen.
health security systems and checkpoint to pass to the faculty of dentistry.
And another question for you is, when did ADEMA open?
3 years ago. We are now in the 3rd course. Yeah.
Yes.
Next year we start the 4th course. Yeah. We have 35 students by any. We start with dentistry degree because we are really 27 years old. We have another ones.
Another brand of technical prostheses.
Technical prostheses, dental hygienics, news, nutrition, other titulation. Yeah.
Mm-hmm.
But the 3 start 3 years ago. We are the very young in Europe. Yeah. The last one, and here we are.
Okay, fab. Well, cheers for that. So again, thanks for presenting to everyone that's on the webinar. I think that's the questions we've got for you guys. And then following this, we've got a short video from the students from Tashkent State Dental Institute, and they were talking a little bit about Virteasy. So let's get them up on the screen.
We're very happy to be here with Tashkent State Dental Institute to install 4 simulators as Virteasy Classroom and to show them the new Teacher PC module.
Hello, my name is Jamila Khan and I'm a third-year student of Tashkent State Dental Institute.
My name is Najia. I'm studying Tashkent Dental State Institute and I like my study very much.
Hello, my name is Nilfai Jurabayeva. I'm a student of Tashkent Dental Institute. Of course, I like this kind of simulators because I can make every kind of preparations in these simulators. And also I like that I can imagine that I'm working with the real patient. I think that it's really good. And I like the feeling between the enamel, dentine and pulp. I can really feel that.
Sometimes before we heard about such program, a simulation program for dentists, but we think it's only a dream. And now when we can see it in our institute, so as for me it's grateful. I'm very grateful to you and to our department of our institute because I'm very happy to wait, and I think it's very necessary to our study.
Our teachers can make a lot of cases for us. Also, in our institute, we have a lot of competitions. It's very interesting that we have an implantology program. I think that's very nice.
Fab. So that was the students from Tashkent State Dental Institute, and we were there early last year. And they're using simulators a lot for competitions amongst students and across different universities as well, which is really interesting to see. So the next thing we're going to do, we're almost coming up to the end now.
I try to be very simplistic. You've got a little tracker which is on the left of the simulator, which is a magnetic tracker. So when you take it in your hand, thanks to a 3D printed handle, you can move it around and it will track your position in the 3D space, and the position of the real tracker, which acts as a mirror, will be translated into the simulation to move the virtual mirror. And then you can just move the 3D printed mirror that you have in your hand and see on screen in the simulation that it acts just in real life. I hope it's clear enough.
Fab. Thank you very much, Pierre-Jean. And for the people on the webinar, you should screen the image second one across is the tracking mirror. So that's the device that's used that Pierre-Jean was talking about. So let's mark that as an answered question. What have we got? I think we hear an echo. Maybe you have your YouTube site up. Yeah, so apologies for all the audio issues we had, especially at the start of the webinar and the live as well. So hopefully that's been okay. Hopefully it's been able to recover. Here's one couple of people as well. How much are the simulators? Well, obviously in terms of the comparison, desktop simulation comes in at less than half the price, high fidelity simulators. But if you want to offer a full simulated training, then it is obviously highly recommended that you have at least some of the high fidelities to offer training in two-handed operation, indirect vision, and be able to use all the validated exercises as well. So for the pricing, the desktop simulation is less than half the price. And for quotes, to give you an idea, just contact sales@virteasy.com for the Virteasy Dental Simulator, and we can help you with desktop simulation. So where in America? Okay, so we've got a few universities in South America. We've got in Chile, Universidad de San Sebastián and Universidad de Concepción. We just delivered a trial simulator on Monday to the Yield in North America, in Canada, Montreal, and we're hoping to be able to tackle a little bit more of that side of things as well. Myself, I'm currently based in Montreal, so I'll be able to answer any queries directly if you follow up with me after the webinar. Here we go, another question for ADEMA. What subjects do you teach at ADEMA? See if you guys are still with us. Can you hear me okay?
Okay.
Yes.
You
okay.
The subjects,
you see all the subjects we have. We have then in second course. We have to search it.
I try to show to you 1 minute in the
screen. Okay.
Yeah.
Yeah. I'll stop sharing my one, and I think if you share your screen now, we should be able to get it up.
Don't worry. Okay. Because don't worry.
Yes.
Okay. In the second year,
we have in the second year, in the first 6 months, we have dental materials, and in the second 6 months, we have dental materials 2 and prosthesis 1 and dental pathology. We have in the third year of the degree of dentistry, 6 months, we have operative dentistry, the blue ones, okay, prosthodontics 2 and pediatric dentistry 1. And in the second 6 months, we have endodontics 1. For year of the degree, of the dentistry degree, we have prosthesis 3, endodontics 2 in the first 6 months, and in the second 6 months, we have pediatric dentistry 2, prosthesis 4, and oral surgery 2. And finally, in the 5th year, we have Adult Dental Clinic 1 and 2, and Child Dental Clinic and Special Patients Clinic 2.
In the last year, really in the dental clinic, to prepare the student with the real patient. We made the real patient, we bring to the simulator, the student is training, and when he made good, he go to make to the real patient, yeah? This is the idea, yeah? For the complexity of the treatments, yeah?
And we've just got a few more that have popped up, so let's see what they are. So Mark has answered.